Okay, so we're clipping for a spay. When you clip, you want to make sure you're holding the clippers like a pencil and you're going against the hair. First of all, we're clipping from the xiphoid process to mid-pubis, and you're going about to the edge of the patient. You want about a clipper's blade width from the incision site. So we're going to be clipping like so with a 40 blade surgical clip away from the hair. You want to make sure it's nice and smooth. Watch out for nipples. And if the blade gets hot, you want to switch it. You don't want clipper burn. The animal's in dorsal recumbency, of course. And you just want to make sure you get the hair nice and short so you get a nice clean area. And that's how you clip for a spay.
All right, now that our surgical patient is prepped for surgery for the spay, we're going to want to scrub the patient as well. Usually we use chlorhexidine and alcohol. You can use iodine versus chlorhexidine, but chlorhexidine has a longer a shorter contact time and a longer residual time. So it's gonna last longer to kill that bacteria that could be still on the skin. The iodine, it's not as client friendly. It stains the fur. It leaves like a weird orange brownish color. And there are more patient reactions with iodine, so that's kind of the pros and cons of those. But you're going to want to do 3 scrubs with the Chlorhex, if you choose that, and then 3 with the alcohol. The only time that you would want to use like sterile water instead of alcohol is if you're using something with like electricity, so a cautery. If you're going to be doing that on any part of the body, you don't want alcohol just on the body, because then it'll light up in flames, and we don't want to do that to our patients. But as far as the pattern you would do the scrub in, we usually use, well, we always do the target pattern. So you're going to take your gauze and just fold it up like so. And then, if I can fold today. If I do it this way, then I actually get it. There we go. So you're going to keep your the back end of this gauze here, because obviously it's dirty, I've been touching it, tucked up, and then your point is going to be there. So you're going to start at the incision site, go all the way around. You might have to kind of move your hand around like so, and this target bullseye pattern. When you get to the end here, you're going to want to just swipe away so you don't get any of the dirtiness that you might have to back up onto the surgical site.
Yes. All right, now we're going to prep the site for a neuter. We're going to clip the cranial border of the testes. So we're first going to push them up and make sure you can see them, and you're just going to go up the cranial border of them, and then you're going to clip around the site and going about a clipper blade and a half away from the site on both sides. And then you're going to go about halfway up the penile bone and make sure that's all clipped. And just make sure you go in different directions, because the hair around the testicles does grow in different directions. You just want to make sure you get all around there. And that is how you prep for a neuter.